We finally have a drug that targets the root cause of Alzheimer's, but it may cause brain swelling or bleeding. Pharmacists in the US are facing one of the biggest paradigm shifts in neurology and specialty pharmacy, the rise of anti-amyloid Alzheimer's drugs like Aduhelm, Leqembi, and donanemab. But here is the million-dollar question. Are these treatments a breakthrough of hope or risk wrapped in controversy? Today, we'll break it down pharmacist to pharmacist, what these drugs really do, how access and insurance play out in the US, what this means for your career, patients, and the healthcare system. Welcome back to my channel. I am Mayank, a licensed pharmacist from RX Indian Pharmacist channel, your go-to guide to pharmacy knowledge. Alzheimer's has haunted families for generations, affecting more than 6 million Americans. For decades, treatment meant only for symptomatic relief. Inhibitors like donepezil, rivastigmine, or memantine enter anti-amyloid monoclonal antibodies. Aduhelm, aducanumab, FDA accelerated approval in 2021, but storm of controversies due to limited clinical benefits and massive price tag. Leqembi, lecanemab, FDA full approval in 2023 shows slowing of cognitive decline by 27% in early Alzheimer's. Donanemab, Eli Lilly's contender, strong phase 3 data awaiting broader approvals. Risks, ARIA, amyloid-related imaging abnormalities like brain swelling or microhemorrhage in brain. The dilemma, do the benefits outweigh the risks? Let's understand. A case study of 67-year-old patient, newly diagnosed. Family was hopeful, but MRI reveals ARIA after a few infusions. CMS, Medicare initially restricted coverage for Aduhelm. Coverage expanded only with registry data. Leqembi, now covered by Medicare, but with conditions. MRI monitoring required. It could treat early-stage Alzheimer's only. Price tags. Aduhelm launched at $56,000 per year. Leqembi around $26,500 a year. PBM's negotiation rebates, but out-of-pocket costs for patients can still be high. Access gaps. Underserved population may struggle due to diagnostics requirements, like as in PET scans, MRIs, neurologists' access. Contrast between a wealthy suburban patient accessing PET scan versus a rural patient struggling to even get a neurology referral. Let's understand pharmacist's point of view on these cases. Let's understand counseling and clinical impact from a pharmacist's prospect. Community pharmacists, patients, and caregivers will ask, does this drug really works? Is it safe? Pharmacists must explain realistic expectations, slows decline but not a cure. Specialty pharmacists, dispensing requirements, REM-like precautions, counseling on ARIA symptoms, headache, dizziness, confusion, and even seizures. Hospital pharmacists, infusion protocols. Hospital pharmacists must educate their patients on infusion protocols, monitoring required by MRIs, coordinating with neurology teams. Ethical counseling, balancing hope versus risk, financial toxicity, and adherence to the regime. A pharmacist explaining to a caregiver that the drug slows progression, not reversing memory loss, and helping them weigh emotional versus clinical decisions. Let's understand its broader impacts, as in on career, patients, and US healthcare systems. Career impact could be new demand for specialty pharmacists, infusion centers, neurology clinical pharmacy roles. For patients, the prospects could be family may view this as finally a hope for Alzheimer's, but also could face emotional and financial stress, as its treatment is still expensive. Healthcare system. What could be the impact on healthcare system? Let's understand that. Strain on diagnostic imaging capacity, infusion sites availability, and Medicare spending. The hope versus hype debate will shape pharmacy practice for the next decade. Pharmacists could either be leading Alzheimer's care team or watching anti-amyloid therapy decline if safety or benefits ratio fails. Let's understand few actionable takeaways. For pharmacists, takeaway actionables could be learning about ARIA, monitoring counseling strategies. For students, explore neurology as an area, specialty pharmacy as a career growth. Healthcare pros could be stay updated on payer coverage, PBM policies. For patients and caregivers, ask the right questions. Benefits versus risk, cost versus quality of life. So friends, if you find this video useful, consider giving it a thumbs up. Subscribe to my channel RX Indian Pharmacist for more useful content like this. See you next week with another video like this. Until then, bye for now.